Okay, so now we get into some of the conditions. So we'll first start talking about some of the different types of infections. So it's viral gastroenteritis, and usually symptoms for viral gastroenteritis will occur about 1 to 2 days after the exposure to the virus. And this could come from either one of two things, either close contact with infected individuals or consuming food that was possibly infected with the virus. Food poisoning, again, if you get contaminated food and water, there's various foodborne bacteria. Staphylococcus and E. coli tends to be two big causes of food poisoning. And, the thing you just have to be concerned about is just, depending upon the type of bacteria, you can have, more severe presentation, particularly like, for instance, E. coli can possibly actually cause kidney failure because of red blood cell destruction. So again, that's something that you'd have to be mindful of as well. And then traveler's diarrhea is usually going to happen. It's an infection that gets acquired usually due to traveling to a foreign country. Various bacteria or viruses that you can get through the fecal-oral route could cause traveler's diarrhea. So a good way to kind of look at, again, whenever you're doing an assessment that involves possibly a gastrointestinal disorder, is kind of break things up, the upper versus the lower GI. So some of our upper GI problems, dyspepsia or heartburn, which is that uncomfortable burning sensation under the sternum, and that's going to be caused by irritation in the mucosa from the upper gastrointestinal area. And again, part of this could be because of reflux of gastric acids, which would be gastroesophageal reflux. And there's various other things that could cause heartburn if you have a dysfunctional esophageal sphincter. Exercise with vertical impact force, psycho-emotional stress could do that, because stress causes activation of the vagus nerve, which could increase gastric secretions. So all of these things can cause this. You can see the little illustration that I have on the right-hand side of the screen, just showing some of the, some of the mechanisms that you can get heartburn and GERD symptoms from. Hiatal hernia is another issue associated with the upper GI tract. So it's when the proximal portion of the stomach kind of protrudes through, comes through the diaphragm. So you could kind of see that in this picture. You can see the normal presentation of the abdomen, and then when you do have the hiatal hernia, and again, this could cause various problems, and again, this could even be possibly a cause of GERD and dyspepsia because of the problems associated with the esophageal sphincter. Peptic ulcers, so when you get the gastric juices destroy the submucosal layers of the stomach or the duodenum. This is attributed many times to a chronic infection with a Helicobacter pylori infection. Also, they do attribute, people who take NSAIDs for a prolonged period of time, alcohol use, nicotine, psychological stress could all predispose individuals to peptic ulcers. Again, the fear with a peptic ulcer is that it could end up causing bleeding or perforation. Here you see this illustrated in the stomach. Gastritis is an inflammation that results from the erosion of the entire mucosal layer in the upper GI region, and there's basically you look at whether you're dealing with an acute or a chronic gastritis and an erosive versus a non-erosive. So make sure that you can differentiate between those. So in the reading, it talks about acute erosive, chronic erosive, acute non-erosive, chronic non-erosive. So make sure that you're able to sort of differentiate between the causes of those. So up here you have the various reasons as to why a gastritis would occur. Okay, now we're going to talk about your lower GI disorders. So inflammatory bowel diseases, so two would be looking at as Crohn's disease and ulcerative colitis. Both of these are genetic autoimmune disorders. Many times they begin in adolescence and early adulthood. Particularly with active individuals and young athletes, you'd want to make sure to really monitor hydration status with this. Just to kind of look at them individually, Crohn's disease is when you start to get that patchy kind of ulceration and fibrosis in the small intestine and colon. And again, this is usually going to be triggered by an interaction between the virus and the immune system. Ulcerative colitis is going to occur lower down into the gastrointestinal system. Many times it begins in the rectum or sigmoid colon and then starts to extend upwards. So basically, in each one of these situations, Crohn's disease kind of starts a little higher up versus ulcerative colitis, which kind of begins a little further down in the gastrointestinal system. Irritable bowel syndrome. This is an irritation involving the colon. However, there's no inflammation present. So basically, irritable bowel syndrome is essentially a motility disorder, and you can kind of see that in the picture where you're basically getting these strong kind of uncoordinated muscle contractions in the large intestine. And again, there's various causes for this. Typically, this will be a diagnosis by exclusion. So, they'll want to rule out other things if a person's having consistent symptoms that may be associated with irritable bowel syndrome. They'll typically also want to rule out some other things before somebody gets diagnosed with IBS. Appendicitis, so this is an inflammation of the appendix, and this could be secondary to an infection or other type of physical irritants. So you can see in the picture the anatomical location of the appendix, and again, that would be, again, your major sign and symptom obviously associated, that would be that pain at McBurney's point, and then there'd be some other, clinical indicators of this. Usually, again, this would be something that would have to be, immediately treated and would require removal, and it takes about 3 to 4 weeks before an individual would return to their normal physical activity after that. Diverticulosis and diverticulitis. So diverticulosis is when you get small herniations of the mucosa and submucosa through the muscular layer in the intestine. So you can see in the picture they're showing the diverticuli. They're basically little kind of out pouches that would form in this. And most commonly they actually form in the sigmoid colon. They usually don't produce symptoms. So these are usually things that don't cause problems. However, if you get a situation where maybe the feces gets entrapped in that herniated section and it causes inflammation, you then get what's called diverticulitis. And you can see in the picture they're kind of demonstrating how that will occur, and then you would get your symptoms associated with that. Okay, hernias. Hernias in general, so anytime an organ or part of an organ protrudes through a defect in the tissue. So, and usually what comes with it is typically in hernias in the abdomen, you get a part of the small intestine and like a small neurovascular bundle that would come with it. There's a couple different types. There's an inguinal, and we have a direct and an indirect inguinal hernia, and then you have femoral and umbilical. So usually that's going to be just based upon location, and you see in the picture here, they're kind of showing you where various hernias occur. So you can see the anatomical location of each one of these. Personally, usually complain of a tearing sensation upon exertion. So now you have direct versus indirect inguinal. So the indirect inguinal is when the segment actually travels down the inguinal canal into the scrotum, as opposed to the direct inguinal, which takes place in the same region but does not does not travel down the inguinal canal. So that would be the difference there. But you can see here your general locations and where they would be located, and it's pretty obvious when these occur. You can palpate them fairly easily. Okay, hemorrhoids. So hemorrhoids, also referred to as piles, are dilated veins in the rectum or anus. You could have both internal and external hemorrhoids. Some people do believe there's a genetic predisposition to developing hemorrhoids. Individuals who a lot of times have frequent constipation because of the straining and the hard stool kind of having to pass, that can also cause this to occur. They could cause a certain amount of discomfort. So, be looking at what are some ways that they can be relieved. Colorectal cancer, the second most cancer deaths, at least at the time this was put together, are caused by colorectal cancer. So you'd want to be looking at, again, things that would predispose people to this. If someone's over 50, they have a family history, high fat, high sugar diet, heavy use of alcohol, individuals with diabetes, individuals who smoke. These are all things that could predispose people. And again, early detection, they do, pretty early screenings for these nowadays. And essentially what they're looking for is the presence of what are called polyps. Now, polyps could be non-cancerous, but, polyps, which are basically little lesions that could form in the gastrointestinal tract, they can potentially become cancerous. So if an individual did have some polyps, they would be monitoring those to make sure that they're not cancerous tumors. And here you can just kind of see, just anatomically, how how that would present in an individual. Spleen and liver trauma. So again, I'll just kind of ask the question again. You can make notes of this, but again, think of your spleen functions and your location. So anytime someone has an enlarged spleen, so if you think of when we talked about mono, for instance, it requires at least 3 weeks after the onset before returning to physical activity, or 1 month or more before strenuous activity. Just because, again, if the spleen is enlarged, it puts it at a very makes it very susceptible to trauma. So the spleen typically is very well situated up underneath the ribs and well protected. If it does get enlarged, though, and starts to kind of creep out from underneath the ribs, that makes it much more susceptible to trauma. So again, be thinking about what would happen there, and where your pain location would be, and what what would be some symptoms of that. Again, for liver, again, think function and location. Again, you'd have a more subtle presentation with this, but there would be certain things you'd want to be kind of looking out for, again, particularly if somebody takes a trauma to that right upper quadrant. Hepatitis is inflammation of the liver. It could happen due to a variety of causes. It could be a viral infection or liver toxicity. And you have various types of hepatitis. You have hepatitis A, B, C, D, and E, okay? And we're going to talk about just kind of how you can get some of the various forms of hepatitis here. For instance, hepatitis A, that's going to occur through the oral fecal route, so many times through food that gets infected through the oral fecal route. And there is a vaccine for hepatitis A. Hepatitis B, C, and D is going to be due to direct exposure to body fluids. So, we have all the body fluids up there that an individual could be exposed to that would transmit hepatitis. It's important to note that hepatitis D is simply a complication of hepatitis B, so you can't get, you won't get hepatitis D unless you have hepatitis B, and there is a vaccine for hepatitis B. There is currently not a vaccine for hepatitis C. And then hepatitis E is oral fecal route as well. It is rare in the United States. If an individual does get hepatitis E, it's usually because they have traveled outside of the country. There's toxic hepatitis, which could occur due to exposure to drugs and toxins. And in this case, usually liver cells become damaged and become necrotic, so that could cause a lot of different complications. And then you just have, in general, chronic hepatitis, which can occur due to being exposed to any of the forms of hepatitis that we just talked about. So when looking at hepatitis, you can look at, there's basically 3 stages, and they'll all present slightly different. You have your initial phase, your icteric phase, and recovery phase. So as you're going through your notes, kind of make note as to how the patient would be presenting and kind of progressing through the individual stages. And note some prevention things as far as hepatitis. So obviously with some of the forms, are particular concerns to healthcare professionals. So make sure that you kind of make note of that as you're going through your reading. Cirrhosis is a condition that results from chronic liver disease, and can also be caused by malnutrition. And essentially what you're looking at here is cell damage in the liver, and that can cause necrosis and fibrosis of the liver. And in the case of fibrosis, when the liver becomes fibrotic, it's going to interfere with the vascular supply and normal function of the liver. This is a non-curable condition, and it does not heal. So, make note of how it can at least be kind of treated from a supportive standpoint. And most commonly, from a presentation standpoint, the individual typically abuses alcohol, and that would be the primary cause. However, there are other ways in which a person can get cirrhosis of the liver. Gallstones and gallbladder disease. So you can look at a picture there of an actual gallbladder with gallstones. And we refer to, the formation of gallstones as cholelithiasis, or cholecystitis as gallbladder disease, and the actual inflammation of the gallbladder. So cholecystitis is going to occur when the gallstones actually block the cystic duct. And that's going to start to produce more severe symptoms. Many times individuals can even have gallstones and they can be asymptomatic. Typically they would get removed through laparoscopic surgery. Some different risk factors for this could be age, obesity, high cholesterol diet, diabetes. Females tend to be more susceptible to this than males because the increased estrogen levels in females can promote the formation of gallstones. Pancreatitis, when the pancreatic enzymes are going to become active in the pancreas, it's going to cause a severe inflammation of the pancreas. In an acute situation, this could be a severe life-threatening condition, which would require immediate medical attention. Infection with this, if it's caused by that, can progress into septicemia or bacteria in the bloodstream. Again, there's various causes of this. Alcoholism can predispose someone to pancreatitis. Gallstones could do this. Trauma to the abdomen, viral infections, drug reactions. Pancreatic cancer can cause inflammation of the pancreas, or even complications from a duodenal ulcer. Chronic pancreatitis would be a little bit of a slower progressive destruction. Again, could still cause some further issues down the road if not treated appropriately. So pancreatic cancer, again, note your signs and symptoms, which again, as you'll see with a lot of the signs and symptoms between all these different conditions, again, they're all very similar. That's why, again, many times when we're talking, prolonged signs and symptoms of different gastrointestinal disorders, you'll have to have further testing done to really kind of determine it. Obviously we know that pancreatic cancer tends not to have a great prognosis, so many times most are diagnosed after metastasis has already occurred. So most of them are that get first diagnosed or advanced, and that's part of the issue associated with this, is that it doesn't typically get picked up fast enough and treated. Many times when individuals find out they have it, the cancer's already metastasized. And these are all your learning outcomes, so just make sure, again, with the actual conditions, again, make sure to use your chart that I've provided you with to get a little more in depth into the signs and symptoms and treatments associated with them.